Hello, Chris Grimmin, Omaha Insurance Solutions. Medicare Advantage has advantages over original Medicare. When I say Medicare Advantage, it's also called Medicare Part C, versus original Medicare is Medicare Part A for the hospital and Part B for doctor and outpatient. There's three clear advantages of Medicare Advantage over just plain Medicare. The first one is the maximum out-of-pocket. When it comes to plain Medicare, just A and B, original Medicare, you have a Part A deductible. That Part A deductible you can pay multiple times in the course of the year. It's per event in a 60-day period. And so you could have that deductible 1, 2, 3, 4 times if you have a really bad year. On Medicare Part B, Medicare pays 80%, which is great, but you're on the hook for 20%, and that 20% is unlimited. There's no cap on it, like you may have experienced with employer plans. There was a maximum out-of-pocket there. The advantage of Medicare Part C or Medicare Advantage is there is a maximum out-of-pocket. Nationally, it's $6,700. Locally here in Omaha, it's much lower than that. And so the advantage of Medicare Advantage Part C over original Medicare is you have a lid on what you potentially could be paying for medical services. Second, you're not required, but you should be getting a Part D. D is in drug plan. If you don't, you'll end up having a Part D penalty eventually when you do get a drug plan. The nice thing about the Medicare Advantage plans is most of them include the drug plan at no additional cost. And so you have a drug plan if you need it. If you're not on any medications, a lot of people find it hard to justify spending $20, $30, $40, $50 a month just to have a drug plan that they really don't use or don't use that much. And so your Part D is included in your Part C. Your Medicare Advantage plan also usually has a drug plan. And then third, with Medicare Advantage plans, you have minimal copays. Now, the nice thing about those minimal copays, it's in a secondary way, it limits what could be charged to you. For example, let's say you go to the emergency room and you have just original Medicare. You're going to pay 20% on a $5,000, $10,000 bill, 20%. Even with the Medicare knockdown, you're still going to be paying hundreds, if not thousands of dollars. On the Medicare Advantage plan currently, nationally, your copay for an emergency room is $90. You know, going in, $90 is the most you're going to be paying for an emergency room visit. And so it limits, again, what can be charged to you. So the advantage of Medicare Advantage or Medicare Part C over original Medicare, just plain Medicare, is you have a limit to what can be charged to you in a given year. You're going to get that Part D drug plan included, no additional cost, and your copays are going to be much smaller than a blanket 20% or a Part A deductible that you'll have to pay. If this has been helpful, I'd appreciate a like, and come visit us at Omaha Insurance Solutions, 402-614-3389. Chris Grimmin, thanks for listening.